Yeah, it's okay to not be okay.
Hello, and welcome to Our Special Lives. I'm Laura McGrath, and today we are talking with Dr. Jane Lee, author of Catastrophic Rupture, and her journey with her daughter, Josephine. Dr. Lee is a doctor of pediatric critical care medicine at Children's Wisconsin. And before we get started, don't forget to hit like, subscribe, and share. Hi, Jane. Welcome to Our Special Lives.
Thank you. I'm so excited to be here.
Well, we're so excited to have you. So I saw this book on one of the Facebook groups that I'm part of, and I was immediately interested in it. It's very captivating title, Catastrophic Rupture. Basically, the story starts out that you were a trauma doctor, and you would sometimes in the pediatric field specifically, and you would see children coming in with very grave injuries or very severe kind of like ongoing. There's one girl that you were speaking about who had a seizure disorder. Mm-hmm. And I think from your perspective, then you talk about being very clinical in your observations of your patients and really not seeing what the parents were seeing and almost thinking that they were a little bit delusional. So can you talk a little bit about that?
Yeah. So I started my career working in the pediatric intensive care unit, and we treated, the sickest of the sick for children. So patients who had experienced trauma, motor vehicle crashes, something like that. And also patients with both sudden onset illness and kids with chronic illness. And those children who had chronic illness, who also had neurologic impairment, I did certainly, treat them in a kind and compassionate way, but I had trouble connecting with them. And I don't think I really realized it at the time that that was my issue. I think I thought it was more of an issue with the patient themselves, that they were incapable of connecting with me. Now I realize it was my issue. And I think many people in pediatrics and in medicine and nursing experience this, where they think that what they're seeing in front of them is all there is. And so this patient that they're seeing who is ill, not feeling well, not at their baseline, not in their comfortable place, they think that whatever interaction that patient can offer them is all that is possible. And so I fell into that trap, I think, just like many, many others of us do.
Yeah, no, I just thought that was such an interesting introduction to the book. So then we're going to fast forward to your own experience. So you had a typical child, Oliver, and then, fast forward a couple years later, you became pregnant with your daughter, Josephine, and then sort of fast forward to Josephine's birth. Mm-hmm. So you kind of go through your birth story. The most significant factor was that you encountered a uterine rupture. So can you kind of start there and just tell us a little bit about that?
Yes. So was pregnant with Josephine. Thinking about the birth process, it was very important to me for various reasons. I really wanted to try to have a vaginal birth after having a C-section with Oliver. And so that led me to make the decision to do a trial of labor after a previous C-section. And during the delivery, I didn't recognize it at the time, and really nobody recognized it at the time, but my uterus did rupture. And the experience itself, from my standpoint, was one of just intense pain, confusion, not really feeling that I could advocate for the doctors to do something because I didn't really know what to tell them to do. And just what felt like a very prolonged period of time where I knew something was wrong, but nobody was helping and nobody was doing anything. And Josephine was in trouble. And it was right after they made the decision to take me for emergency C-section that it really kind of hit me that I felt like she was dying inside of me. And I just felt like all hope was lost, and that that we weren't going to end up with a live baby after that.
And just in case somebody in the audience is listening and doesn't know, when you have a uterine rupture, that means that the blood is kind of flowing into your body and away from the baby, correct? Like the baby is not getting a blood supply?
Right. So Josephine was pushed out of my uterus through this gaping hole in the side of it, not born to the outside world, but born into my belly. And the placenta detached at that time. So she was really, suffocating in a pool of her own blood inside my body with no way to get out. And yeah.
And, I had a similar situation happen. I didn't have a uterine rupture, but my son, I had a difficult birth process where I was laboring naturally and then my labor slowed. And so in an effort to jumpstart my labor, I was given Pitocin, and that caused my uterus to contract so severely that my blood pressure started dropping and the blood supply to my son was inadequate. And then to make matters worse, his umbilical cord was sort of over his right shoulder. So every time I was contracting, he was getting a sort of pinched off blood supply, which obviously carries the oxygen. So he was severely under oxygenated for about 30 minutes before labor. And I think we probably both had the same, not fun experience of your baby being born and they're kind of that weird gray color. That's not good. You called it dusky. I called it I don't even know what that gray color is, but it's not good.
Yeah. And I actually, because it was an emergency C-section, they put me under general anesthesia. So I didn't see her. She was taken away while I was still under anesthesia, and I didn't see her until much later when I went to visit in the NICU.
Yeah. And we also had a similar experience in reading through your experience. I think initially there was some talk of her going to, being rushed to the NICU and to perk up. And you saw her twitching and you were like, that can't be a seizure. I had a similar experience where, my son was resuscitated and then whisked off to the NICU, and I was taken to see him relatively quickly after about an hour, and his face was twitching. And I said, what's happening? And they said, oh, it's very common when babies get stressed, he's having a seizure. And I was like, none of this seems very common at all. What is happening? And it was just this weird feeling of almost feeling like you were in the twilight zone, because what you could see happening didn't really match at least for me, it didn't really match the information that I was getting in terms of, the baby being stressed and, the perking up, and I'll perk up and, all of that kind of thing. And it was just, I could tell instinctively that something was very wrong.
Yeah. I had almost a little bit of a different experience in that, because I'm a physician and I was talking to my colleagues, people who knew me first as a physician and second as the parent of their little patient. The information they were giving me was information that was framed as medical speak. And I should have been able to interpret it. I should have known what was going on. But instead, initially, I thought, well, that's crazy that you would think those are seizures. That's not seizures. She's going to be fine, because she just needs to recover from the delivery and then she's going to be fine. But I should have known. I should have known from everything that happened during the delivery and just from my background, I should have known that she was not fine and not going to be fine. And they were giving me information that I should have been able to interpret that way, but I just was not in the frame of mind where I could do that.
Yeah. Yeah. You are almost in a state of shock when this happens. And it's like trying to process complicated information almost becomes impossible.
Absolutely. Yep.
So then you talk a little bit about the guilt that you had. So, so can we talk a little bit about that?
Yes, we should. And I think, so I had tremendous guilt that lasted for years. And I think that many parents, many moms probably in particular, feel guilt when something happens to their child, whether it was in the realm of their control or not. I think it's just natural for us to feel guilt. And I think mine was probably um, uh, kind of amped up because not only did I feel that I had let my child down as her mother, I felt that I had made poor decisions, made selfish decisions that I should have known better as a physician. And so I, yeah, the guilt was tremendous. And I don't know if there's any way really to have escaped that. I think it's probably a natural reaction of a parent.
Yeah, I think so. But, remembering that so many women have sort of natural births after C-sections. This is a thing that happens every day. So for you to make that choice was really not something out of the norm. Do you know what I'm saying?
Yeah, I do. And when I think about it rationally, I do know that it was a reasonable choice. And I consulted with my doctor. I looked at the history and the statistics, and, it was absolutely a reasonable choice. But when you end up being the 0.5% that ends
Yes.
up with a bad outcome, it's hard to feel like you made a good choice.
Yeah, I know that I totally understand that as well. I mean, I just kind of think, I wasn't offered a C-section, but I think for a long time I was like, I should have asked for one. I should have realized something was going wrong.
Yeah, right. There's this thought that, oh, I should have known, like I should
Yeah.
have asked, I should have made them do something else.
Right.
When really, how ridiculous is that? No, you
Yeah.
shouldn't.
I was
Yeah.
kind of doing the best I could at the time with the limited information that I had, and kind of, relying on the people around me to sort of make those higher level decisions. Because, I was in labor, I was preoccupied, right?
Right.
So, so then you talk about being in the NICU
Mhm.
and kind of, I think it was at this point that you were kind of slowly coming to realize the seriousness of the situation.
Yeah. Yeah. My daughter initially was very, very unresponsive, I guess, for lack of a better word. She really didn't, she didn't do much of anything. She kind of just laid there. Um, and as the days went on and she continued to be unresponsive and really not able to, control her airway, control her secretions very well, really not able to move her body at all. It really started to sink in that this is not just going to go away. She's not going to recover from this. This is where we are, and this is where we're going to be. And that was really, really hard to deal with. And yet at the same time, although what we were seeing in front of us was bad, really nobody could tell us that it wouldn't get better. And they kind of told us, well, you have to wait and see, which I was fine with doing, but it's hard to be told wait and see and not get your hopes up that things are going to really get better. It's hard to accept your situation and wait and see at the same time.
Yeah. Yeah, the way we sort of viewed it is there's like 50 doors in front of us, and some of the worst doors started closing, but some of the best doors started closing too, and it was kind of like we ended up somewhere in the middle. Over time eventually, but we never closed a door until we were sure. And some of the doors that stayed open actually ended up being good doors. So
that's a really interesting way to look at it. I really like that analogy. I had never heard that before, but I really like it.
Yeah. One of the other things you talked about during that time was trying to relay information to friends and family and think you're being clear about Josephine's in the NICU. We had this really serious situation come up during the birth process, and she's not doing well, and people on the outside just not really getting it.
Yeah.
And
Yeah.
that's a
I
fascinating
realize
phenomenon,
it is. And I don't know if you experienced this too, but, and I didn't realize that they weren't getting it. I thought that they, weren't coming by and weren't, calling because they just wanted to give us our privacy and give us our time. And I thought they were just being respectful. And as it turns out, they really had no idea that there was anything as serious as it was going on. And so I learned that really, if I'm saying something and it has a lot of kind of hidden implications that I think are going to be apparent, I need to spell that out. Even my mom, my husband called my mother shortly after Josephine was born and said, we had our baby, she's in the NICU, she's intubated. And my mom, who's a nurse, thought nothing of it. She thought, oh, well, she was born a little bit early, so of course she would be in the NICU. And, of course she might need a breathing tube. So it didn't even click for her that something was really wrong.
Yeah. Yeah. No, I would say we had a similar experience. And I mean, quite honestly, I had never really understood that sort of birth hypoxia was even on the menu of things that could happen when I had a baby. I didn't understand that concept. Obviously, I'm not a doctor, and even if I was, I don't know, it's just not really something that you're really educated about or is really talked about. Like you said, it's 0.5%, depending on which statistic you're looking at, of children who are born with birth hypoxia. And even of that group, a lot of kids with HIE1, for example, really do bounce back.
Yeah.
And
right.
so
they turn out fine.
yeah, and they turn out fine. And even sometimes HIE 1, 2, or 2. And so it's like I didn't even know this was on the menu. And so I even had no idea how serious this was. I didn't even know what was happening until the day after my son was born. And at our NICU, there were visiting hours, and then you had to leave after a certain time. So the night that he was born, we couldn't stay. And so the next morning, the neonatologist was rounding. And, I saw my son, he was hooked up to every machine. And, I remember there was blood in his catheter bag and all of it. And I said, I don't understand what happened. And it wasn't until then, almost 24 hours later, that she explained to me that, there was basically he suffered a hypoxic event. And that not only was his, brain deprived of oxygen, but also every organ. So the only organ that was not hurt was his heart. And that was the only reason he got his initial APGAR scores, was because he still had a heartbeat.
Wow.
But, his kidneys weren't working, his pancreas wasn't working, his lungs kept sort of collapsing. And, nothing was really working the way that it should. And I mean, she was pretty honest with us that she didn't know, if he was going to make it. And in fact, he did code, I guess, a couple of times during that 48-hour period. He had a cooling cap. Did Josephine have a cooling cap?
No. Which is, something in hindsight I regret. I mean, it was never an option. They just didn't, she didn't have any blood in her cord to send a blood gas. And they just thought that she wasn't going to be that severe. So they didn't cool her.
Yeah. Well, my son went through the cooling process, and that is, that creates instability as well, in addition to all the trauma that he had already suffered. And so it was during that cooling period that there were a couple of times where they had to kind of bring him back. But it is really interesting. I'm going through all of this, and it's so unbelievably traumatic and complicated and all of it. And I literally would have friends say like, oh, we hope we can laugh about this in 6 months. Like, what's going on? Like, I couldn't really reconcile the two things. And also there's just a level of such deep grief and exhaustion that you can't even really communicate very well. And the trying to communicate with a lot of people who are very well meaning and really want to know how things are going, that becomes even more exhausting on top of it all. We ended up starting like a blog, just to kind of do a daily update that people we knew could just check in, because we just didn't have the ability to communicate to a lot of different people.
Yeah.
And we found that to be really, really helpful.
Yeah.
So you kind of came to terms about what happened, and at some point you bring Josephine home, and then you go back to work. Mm-hmm. And what was the turnaround on that?
So I had 12 weeks of maternity leave and then went back to work after that. And by that time we had settled into a pretty decent routine at home. And we were at least meeting her medical needs and, her care needs. But I was still, in that period of time, I was still having a lot of trouble really accepting it. I knew what had happened and I knew this was our reality, but I had trouble accepting her for who she was and trouble bonding with her. And I think a lot of that was because at that point she was still not that interactive and not that responsive. And so I needed something from her that she couldn't give me in response, in order to be able to bond. But yeah, I went back to work, and that was hard too. It was hard because now seeing other children, some in a similar situation, some in a much different situation, it was hard for me to give my patients and their parents attention that they deserved, because I was pretty wrapped up in my own issues at that time.
Yeah, I mean, it is really hard. I definitely also went through a period of time where, and it was weird how things hit me, but it was just things like, my son wasn't able to use his hands to pick up things. And, I had a lot of nieces and nephews born kind of around the same time as my son. And, I remember one year, I think the kids were like around 2, and, I was watching my nephew open a Christmas gift, and it just broke my heart. It was, and it, like, I was so happy for my nephew, it had nothing to do with that, but it just reflected just such a deep sadness that my son wasn't able to do those really basic things. Yeah. And just the unfairness of it for him. Yeah. I think that was something that was really hard for me to process when I would see other kids just doing things so naturally and so easily, and just wondering, like, why is he suffering so much?
Yeah, it really is. It's hard not to make comparisons, especially when the kids are really young and the development in other kids is happening so fast and they're learning so many things. And it's hard to not just feel really a lot of grief over the loss of that potential to develop that way and just have things come easily, and, to sit up and roll over and open a gift and all those things.
Yeah. So you talked about going back to work, and then you talked about, things you kind of hit that, I always say having a special needs child is like being on a roller coaster. So you were kind of cruising for like a little bit. And then Josephine developed infantile spasms. Yeah. So it's kind of like it's kind of like the dark period of time. And I think I certainly went through it, and I'll talk about that. But tell me about your dark days and the infantile spasms.
Yeah. So Josephine developed them when she was 6 months old, and she had just started in the couple months before that to really make some progress. She had started to smile, which was huge, and started to make eye contact and look around a little bit. And I was really starting to feel like I was connecting with her, and, that she knew who we were. And then the spasms started out of the blue, as they do. And after that, she was just different. She lost that spark in her eyes. She really didn't respond to us at all. She really, all she did. And at the same time, so she lost her development and her responsiveness, but at the same time, her spasticity and her dystonia really ramped up. And so we had this child who would not acknowledge us in any way and just spent all of her time, arching and thrashing and throwing up. And I had no idea. I mean, I knew from my pediatric training that this was bad. Infantile spasms is bad. And I didn't know if there could be any hope for her to get through that and start making progress and, gain that spark back and gain that acknowledgement, that, that interactive ability back. And so it was that was the worst part of the worst point of my life, and certainly the worst point of my relationship with her, because I felt like it was completely severed. Like I couldn't reach her at all. I didn't know if she was even still in there, but if she was in there, I couldn't reach her. And it was horrible.
You said in the book that you wondered, if it was even, you just sort of wondered for her whether it was even worth it to live because of the quality of life deterioration that you were seeing.
Mm-hmm.
Yeah.
Yes. And that was the time, early on when she was in the NICU, I also wondered whether her life was going to be worth living for her. But then she made some progress, and I thought, okay, this is okay, especially when she was able to smile and kind of show that she experienced some pleasure, experienced some joy. But this period of time was just all bad. It was like there was nothing positive in her life or her experience. There was nothing I could see that was telling me that this was okay for her at all. And so I really did start to question. And that's a horrible thing as a parent, to have to question whether your child's life is of benefit to them, whether this is something that ought to be sustained. And I'm so thankful that there wasn't a choice at that point. There was nothing to withdraw or remove or limit. There was no choice to be made except to move forward. And so we did, and things got better, but I didn't know at the time whether they would or not.
Yeah. I think it's the suffering, I find seeing your child suffer is kind of like a next level experience that no one should have to go through, but unfortunately we do. Mm-hmm. And my son, I had an experience with my son where he had a very floppy airway. He's very hypotonic. And so he had a surgery when he was 3 months old to kind of open his airway a little bit, a supraglotoplasty, and that worked for a while. But when he turned 1, he had kind of outgrown that modification. Mm-hmm. And the amount of air that he needed to inspire would just kind of overcome his airway. And he developed a really bad stridor. He would struggle to breathe. And mm-hmm. then that turbulent airflow caused him to incessantly vomit. So I really totally got what you were saying with the incessant vomiting, because, then we were worried about aspiration and bronchospasms and all of that kind of stuff. Mm-hmm. And we would have to, we kind of knew when he would sort of choke and gag, and we had about 8 seconds to get to him before he would aspirate. And there was this thing that we had to do where we kind of flipped him upside down and cleared his airway. And it was just, it was such a terrible existence for him. And we took him to many children's hospitals. We were not really qualifying for a trach because he never had blue spells and he kept his oxygen up. But it got to a point during that 6-month period, from about 12 months to 18 months was kind of when this was all going on. It got to a point that he had been, like Josephine, very engaged with us. But the work to breathe was so intense for him that it was all he could do. He had no quality of life at that point. He would just sort of check out and breathe, and that's all he could do. And he sounded horrible. Like it was just the most awful sound. I can't even describe it. And then the vomiting, and it was just this 6-month thing. And finally he had lost so much weight. He was 9.5 pounds when he was born. By 18 months, he was only 17 pounds.
Wow.
Yeah. So he was emaciated. And so finally, we were able to get him a trach when he was 18 months old. And it was like overnight, all of that disappeared. He stopped vomiting. He gained like 30% of his body weight within 30 days.
Wow.
Yeah. Just because he could finally breathe.
Yeah.
So again, it was that roller coaster. It was so low for 6 months. And my husband and I, we really questioned, we were like, why, we can't just let him have a life of suffering. Like, this doesn't make any sense. He's got no quality of life. So it's really, really bad when you get to that point. And I really related to, to your feelings on that at that point. But for both of us, luckily, it did eventually get a lot better.
Yeah. Yeah.
So you were able to get treatment for the infantile spasms. I didn't even know that it could be treated and resolved.
Yes. So it can be treated. We got the treatment, there are several treatments, but for us, the one that they recommended were these injections of a hormone, and it stopped her spasms. And that was wonderful, because then once those were stopped, she was able to slowly regain some of her skills and continue to make progress and continue to show some development. So yes, it was a huge setback and a really dark time, but we made it through.
Then you talk about how it was affecting your work a little bit. Like, you talked about a patient who came in who had some brain swelling, and you were almost like hyper vigilant in a way because of almost like the PTSD that you had from Josephine's birth. You almost had become hyper vigilant about certain of your patients.
Yeah. And I really, after having been through something where the doctors and the medical team were doing their best, but they just made mistakes and they missed things. And we and Josephine, have to live with that for the rest of her life. After going through that, I was just terrified that as a doctor, I was going to do the same thing and miss something or make a wrong decision or, just a bad decision, and have some other family have to go through something similar to what we went through. And so it really weighed on me when I went back to work, and it did make me hyper vigilant, checking and rechecking. And sometimes in an ICU, in the middle of the night, it gets too busy to do that, to double check everything and to do everything. And so, yes, there was this one patient in particular that I wrote about that I felt that I could have done better, that I ought to have done better. And seeing her family realizing and taking in what was going on, and realizing that their child was, something irreversible and horrible was happening to their child, and feeling like I was a part of that, whatever small part, was really difficult to deal with. And then it made me wonder if I was providing the kind of care that I ought to provide. Was I so focused on the numbers and the labs and the test results that I wasn't being there for my families the way I ought to be as a human? Was I connecting with them? But on the one hand, I was almost connecting too much, because I felt like I was, experiencing it with them at the same time, but not as their physician. I was, experiencing it as I was remembering my own experience. So it was a really hard thing to go through, and a hard time.
Do you think that played into moving over to the more complex care side of things as opposed to being in the ICU, or did that have nothing to do with it?
No, I think it did have something to do with it. The main impetus was just that the complex care program was losing some physicians and they needed help. And, it's a patient population that I have always been comfortable caring for and enjoyed caring for. And so the initial move was more logistics, but I think that at the back of my mind, the thing that made that an appealing move, or something that I was willing to do, was the fact that the certain stresses of working in the ICU were just weighing on me more, and I was ready to be done with that.
It's totally, totally understandable. One of the things that surprised me is that you talked about the Medicaid waiver,
Mhm.
but it came a lot later than I'm typically used to seeing. I mean, Josephine was like, how old was she when you ended up getting the waiver?
She was, well, she was 4 months. So
Oh,
yeah, I mean,
4 months. Okay. I
yep.
must have I must have misunderstood that.
I
I thought it
talked
was
about it
later.
later. Yeah.
Okay.
I like it came up in the book later as I was
Okay.
reflecting on how many things I didn't know and, things that nobody told me. But yes, we ended out getting it when she was still 4 months old.
Yeah, because and did she ever get nursing, or was that ever part of your setup
No,
with the feeding tube? And is she
no,
still tube fed?
yes.
Okay.
Yeah. 100%.
Um, yeah, because that was one thing that was just kind of a lot to deal with. Like, we had some nursing when my son had a feeding tube, but then when he got his trach, he just needed more because he's
Mhm.
total care. And managing that piece of it is tricky and definitely adds another layer. But I didn't sound from the book like you guys had gone down that road, so I was just curious.
Yeah, I think, are fortunate in that we were in a position where one of us could quit our jobs and stay home. And my husband was, for various reasons, we decided that it was better for him to do that. So when Josephine was 1, he resigned from his job and he's been a stay-at-home dad ever since. And so we've just worked it out where, we haven't had to get nursing care or any kind of outside paid help. And that has worked out really well for us. Although now, as she's getting older and just heavier and bigger, it's harder physically to take care of her. But yeah, we've been able to do it just with my husband and I.
Yeah. Oh, that's good. That's really, really admirable. One of the things in the book that I thought was really cool was kind of the transformation of how you viewed neurologically impaired patients. So
Mhm.
you sort of start the book by talking about how you're having this experience where you're talking to a child and you're not perceiving anything going on. And yet her mother is like, oh, she just reacted to you. And you're like, oh my gosh, she's delusional, right?
Yeah,
And
yeah.
then sort of fast forward, you have this experience with your daughter and you've almost learned the nonverbal language. You've learned the
Mhm.
subtle cues, you've learned the subtle eye movements and all of that. And you can kind of start seeing that in some of the patients that previously that level of communication was not something you were able to perceive.
Yeah. And it really opened my eyes. And there are still, many patients where I don't know their cues, but at least I know that they have them. And I know that, if the parent's saying, oh, he or she feels this way, or, this is going on, I know that they know that they're not making it up or that they're not imagining it, that it's really there. And I think if I can do anything with this book and with my experience, my hope is that one of those things would be to convince other clinicians of that same thing, that even if they can't discern it, even if they can't pick up on the cues, to know that they're there and to know that there is much more going on with this person in front of them than the disability that they see on the outside, that there's a lot more going on inside. And it was, once I had that realization and at work, and I was, trying to make deeper connections with my patients and with their families, I was kind of stuck in this place of wanting to bring my colleagues along with me, but not quite knowing how to do it and not wanting to be seen as, oh, well, Jane, she's just oversensitive. She's just, she's one of those delusional parents now too, because, she's got a child with special needs. And so I didn't quite know how to handle it, but I certainly recognized the change that was happening in me. And it was a welcome change.
Yeah, that's wonderful. That's such a powerful message. Were there any other particular reasons why you wrote the book? Like anything that you really wanted the audience to get?
Yes. So the influencing clinicians was one reason, but the other big reason was just letting other families, other parents know that they're not alone, that especially if they have a hard time. When I was starting this, when Josephine was very young and I was struggling to bond with her, to love her, to accept her, I'm a reader, so I looked for books that would reflect that same experience, and I didn't find any. All I found were, books that talked about, what a blessing this is, and we only get the challenges that we can handle, and how a child with disability just really brings something special to the family. And that is not how I felt. I felt like, this is hard. This sucks. This is like, why did this happen? And how are we going to get through it? And I wanted a book that said that, that said that it's okay if you don't think this is a blessing. It's okay if you don't think that that this is a good thing for your child and for your family. And so I really wanted to put that out there, and to put my negative experience, the negative part of my experience, out there, to really let families know, you're not alone.
It's okay. It's okay to have these feelings. Yeah.
Yeah. It's okay to not be okay.
So important to realize that we're going to have a gamut of thoughts and a gamut of emotions, and they're not all going to be good. They're not all going to be, well, at least, my son survived, I mean, that's, there were some days when I was like, I'm actually not too happy that he survived, because he's suffering so much, And I think we all have to acknowledge that we all do have those thoughts, because trying to gloss over the reality of the situation and the reality of what we're thinking and feeling only makes it worse, and only makes us feel more separate.
Yes, exactly. It makes you feel like you're the only person who's ever felt this. And if you're not the only person who's ever felt this, then you're all bad people, So
yeah.
I really think the connectivity piece is really important. I think that, we parents of children with disabilities and medical complexity are very isolated for a number of reasons. And a big support in getting through this with some semblance of, happiness and being well-adjusted is to make connections with other people. And so I think, hopefully this book helps that, but I think there have to be other avenues too for families to make connections and feel supported and feel a sense of community.
Yeah. What are your kind of go-to resources for that?
So the main things are honestly some of the social media groups that I belong to, and just, I find that they're a good source of parents who can also offer not only practical advice about, hey, I'm experiencing this. Has anybody had this happen before? And also just a place where you can reach out and say, boy, I'm having a really hard day. And, tell me that it's okay. And so, yeah, I'm an introvert. And so I don't tend to want to go out and, socialize in big settings with a lot of other parents, but I do find social media to be helpful in that way.
Yeah, I also find it helpful. And I am also introverted. What I found for me that was problematic about kind of getting set up with other parents who have children with special needs is that the needs were so different, and the scenarios were so different, and the issues that I'm worried about with my child not being able to breathe are sometimes very different than another parent might have with a child who, has, is on the autism spectrum. It's just, that was really hard for me. And I think very well-meaning people tried to kind of set me up with other parents of children with special needs, but it just, it kind of left me feeling a little bit more isolated. I find that the social media groups are a little bit better in that oftentimes you can kind of pair up in a group with a more specific match to what you're going through. So if someone's kind of wondering which direction to go in, I would say try to dip your toe into social media first. It's just a little.
Because there are groups for, like you said, there are groups for everything, and groups that are pretty specific in terms of either what the cause of the disability is, or what the outcome of the disability is, and or what your what your situation is that you need help with. So I agree. That has been really helpful to me.
Yeah. Well, maybe afterwards, you could tell me kind of like maybe 3 or 4 of the groups that you find to be the most helpful, and I can post a link to those if people are interested in,
Yeah.
finding some additional resources. The last thing I want to talk about is there's sort of a theme, I think, at least I picked up on it going into the end of the book, where you've really been able to transcend a lot of your grief. And I just wanted to know, for other parents who are out there might be struggling, what was kind of if you had to say like the biggest thing that contributed to your ability to transcend some of that grief, what do you think it would be?
I know what it was, but I don't know how to help other people do this. So for me, it was really this realization, this kind of epiphany moment where I really realized that who Josephine is not the same as what Josephine can do. And I had spent so much of my life up until that point being demoralized and crushed when she couldn't do something, even after, months of therapy or, this equipment or that equipment. And in hindsight, I recognized that part of my grief at her not being able to do things was because not doing those things in my mind meant that she wasn't going to be a certain kind of person. And once I realized that, and that those things are separate, and she can be a happy, fulfilled, respected, valued person, regardless of what she can do or not do, that is when my grief was kind of just fell away. I'm still sad sometimes, but the pervasive grief fell away. And I was able to really recognize the joy in simple moments that are just, her existing, being herself, her experiencing her life. And I couldn't recognize that joy before because I was so distracted by the functional outcomes that I didn't pay attention to just who she is. So that is, the epiphany that helped me. But I don't know, short of just explaining that's the transformation that I made, I don't know how to help another family.
Well, I think that was beautifully said. I mean, really, really beautifully said. And I think that actually will help a lot of people, because I do think we get so caught up in measurements of things and just really deeply accepting the soul of who our child is, and that they are so valuable and so lovable, and they love so much just being who they are, as opposed to taking any metric at all. I think that deep acceptance is the way to overcome the grief. And I think you said that beautifully.
Thanks.
Yeah. So thank you so much for joining us. This was a wonderful talk. I'm going to link to your book. I think it could really help a lot of people who are struggling with a lot of these issues. I think regardless of your child's diagnosis, I think a lot of the emotions are the same. A lot of the grief is the same. A lot of the challenges, while they might not be exactly the same, the road to getting through those challenges is similar. So I think anybody could get a lot out of this book if you've got a child with special needs. So thank you so much for joining us today.
Thank you too. I really enjoyed speaking with you.
Yeah. Yeah, it was great.